So you've got dry eye, but you're dying to wear contact lenses. Today, we're gonna go over some of your options and I'll give you some tips and tricks so you can get wearing contact lenses again.
Welcome to Salisbury Eye Care and Eyewear. I'm Dr. D. My goal is to arm you with the knowledge you need to take control of your eye health and have the best vision possible. Like and subscribe for videos every Wednesday at 4 p.m.
Hello there, it's Dr. D again. I'm a doctor of optometry with my own private practice. I'm residency trained in ocular disease and I specialize in dry eye. Here on this channel, I post educational videos about eye health as well as vision products. If you're new here, please consider subscribing and don't forget to hit that bell so you never miss one of our videos. For today's video, I've got a lot of helpful information. It's down in the description box below, so feel free to check out the show notes at any time during today's video for that information. Today's video is for you if you've got dry eye syndrome and want to wear contact lenses. We're going to go over dry eye in general and why it makes contact lenses difficult to wear. Then I'll talk about a method or two for wearing contact lenses again. We'll talk about the best contact lenses on the market for folks with dry eye. We'll also cover some artificial tears you can use to help lubricate your dry eyes in contacts. And finally, we'll give you some tips and tricks when you have dry eye syndrome. Okay, my pupils, it's time for eye school. So you may have dropped out of contact lenses in the past due to dryness, or maybe you've never actually worn them because you were told you were not a candidate due to your dry eye syndrome. Let's go over dry eye and talk about why it makes contact lens wear difficult. So dry eye is defined by the DEWS report, the Dry Eye Workshop, as a multifactorial disease that leads to discomfort, tear film instability, and potential damage to the ocular surface. If you suffer with dry eye syndrome, you have greater inflammation at your ocular surface. So when you wear contact lenses and you already have an inflamed ocular surface, you're effectively putting a foreign body, this medical device, into your tear film. Now, contact lenses, there's a couple characteristics about them that can make them difficult to wear when you have dry eye. Number one, most soft contact lenses today are made of silicone hydrogel material. The problem with that material, although it's very breathable, the silicone is not very wettable. It's what we call hydrophobic. Hydrophobic molecules tend to repel water. Now think about a lens sitting in your tears all day, which are already maybe reduced or a little dry or inflamed. And then with wear time, the lens treatments break down and that contact lens becomes unwettable. That makes for a very dry wearing experience in contact lenses. So that's the issue in dryness and wearing of contact lenses, is finding a lens that's going to be able to live in a dry, inflamed ocular surface environment without causing you poor vision, visual fluctuations, irritation, discomfort. All right, so there are some options for dry eye sufferers. First of all, if you've worn contacts in the past and had to drop out of them, I want to first say that monthly contact lenses have come a really, really long way. So if it's been upwards of 10 years, we do have new monthly contacts on the market that may be more wettable than what you had tried in the past. However, in terms of soft lenses, my favorite are dailies. And in particular, I've got two favorite lenses for my patients with dry eye, the Dailies Total 1 and the Precision 1 lenses. I actually made a video about these very recently. I want you to check it out right here where I go in depth on the material and we talk about water gradient technology, how those lenses are silicone hydrogel at the core, but they turn into almost 100% water at the outsides of the lens. Now, when you talk about dryness and wearing contact lenses, that's a very positive lens to put in your eye because of that water at the outside surface. As you can imagine, it's a lot more comfortable to have that really slick, wettable surface. It actually releases with your blink, and when it detects that your ocular surface is becoming dry, it releases more of its wetting agent as well. So I love Dailies Total 1 and Precision 1 for dry eye patients. Those two lenses are dailies, and I also love dailies for my dry eye patients because it's a one-time use lens. In other words, it comes out of the pack in the morning, you wear it all day long, and then at night you throw that lens away. This is wonderful because it's the first day of contact lens wear every single day. So those are your soft contact lens options. You can talk to your eye doctor about the advances in monthly contact lenses, maybe compare the new lenses to ones you've worn in the past and find the right contact lens for you. The other option is to move toward a daily lens, which is something I would definitely advise. I think that that's really smart when you have dryness. If you've tried all of those options and you say to me, Dr. D, my eyes are still just so dry, there's no way I could wear a soft contact lens. I hear you. There's many folks who have just too dry of an ocular surface to sustain soft contact lens wear. But that's why we have hard lenses. So I made a video all about RGP lenses and scleral lenses. I'm gonna make sure to put them up here, RGPs first. And then in a few seconds, we'll do sclerals as well. I want you to check those videos out because I go in depth on those types of lenses and how they perform, but I am talking more about irregular astigmatism in those videos. So let's talk a little bit about scleral lenses and their uses for dry eye. So sclerals are wonderful when you have dry eye because they actually vault the cornea and they sit on the sclera so that they don't irritate the cornea further. These lenses are designed to give you constant hydration. So tears are trapped underneath the lens. You actually fill the bowl of the lens with saline, and that's going to keep the eye hydrated at all times. Another thing that's interesting about sclerals is we can add artificial tears or antibiotics to the bowl of the lens. So if you watch my video, you'll see that they're inserted a little bit differently. You actually have to fill a scleral with saline or with solution as you put it in, and then that solution is trapped actually at the surface of your eye. And the wonderful thing about sclerals is we can use an artificial tear in there to keep your eye that much more moisturized throughout the wearing day. The next wonderful feature of a scleral is that it acts as a literal shield to your eye. It mechanically protects your cornea. So it is a hard lens, vaults over the surface, and it's acting like a shield. And so your lids aren't interacting with your cornea, you're not causing further dryness and inflammation and irritation. You've got this wonderful shield covering your cornea, which helps keep it comfy, cozy. Another positive of sclerals is that you can actually use artificial tears over them. So many times with soft contact lenses, you're very limited in your artificial teardrop options, but in sclerals, you can use drops over them as much as you would like. So I've seen in my patients increased quality of life wearing scleral lenses. These are a really great option for dry eye sufferers. Again, it gives you that shield. I've seen patients have to use drops less often, better quality of life, better vision, and just less irritation with their condition overall. If you thought you weren't a candidate for contacts because of your dry eye, sclerals may be a wonderful option for you. Now for some tips and tricks regarding contact lens wear with dry eyes. First of all, if you're wearing soft contacts, I would recommend always using a non-preserved artificial tear over the lens. We want to avoid preservatives because soft lenses are like sponges. They are going to hold onto preservatives and chemicals both in the environment and in artificial tears or other drops you might use. So try to stick with the non-preserved tears whenever possible. I've got some of my favorites down in the description box below, and I also made a video about Optase, which is a wonderful tear you can use over contact lenses. The second tip I have for you is to use a truly hypoallergenic makeup. So I referenced the DEWS report earlier, and I can tell you that some of the folks involved with DEWS actually came out with a makeup line. It's called Eyes Are the Story. I'll link my review and unboxing of Eyes Are the Story right here. But that's a wonderful makeup, free of chemicals, really safe for dry eyes that I would recommend you try wearing with your contacts. All right, a couple tips that are just sort of general and seem obvious, but I'm gonna always encourage you to drink plenty of water. If you stay hydrated, you'll have more tears and it'll help with your dryness. You also may want to consider being on an anti-inflammatory type diet. So avoiding things like excess sugar and caffeine can really go a long way. Your diet does matter when it comes to your dry eye symptoms. Another one is to avoid blowing air. You probably know this if you have dry eye, but it's difficult to sit in a car with vents right on your face. It's very, very important to be cognizant. The one that most of my patients forget about is sleeping under a fan. So if you remember, just turn off that fan, maybe get it pointed in a different direction, not directly at your face while you're sleeping. And then my last tip about the contact lens wear is to really adjust your expectations about your wear time. So this can be a little bit of a tough pill to swallow, but sometimes if we go into the situation sort of thinking of it differently, we'll have greater success. And so some of my dry eye patients will have this conversation. You know, I'll ask, what is your goal? Are you trying to do this all day, every day, or would you be happy with wearing your contacts just for date night? And so sometimes if you adjust that expectation a little bit, you can get back into contact lenses and wear them occasionally and be able to change up your look and you know, maybe for active pursuits, kind of get out there and wear contact lenses for those things. So again, just adjusting your expectations, kind of taking stock of what's most important to you in your daily activities and seeing if contacts are a good option for those specific activities. All right, so if your eyes are feeling dry, let's say you're having a really dry eye day, I would tell you to avoid wearing a soft lens in that instance. Now, a scleral might be okay. Again, it might help you heal a little bit because it is acting as a shield. So how to make sure your contacts aren't making your dry eyes worse. So I'm always going to recommend that you have an annual eye exam, that you follow the directions of your eye doctor. I would say as a rule, never sleep in your contact lenses. Use artificial tears over them, and if you have any redness, sensitivity to light, vision changes, pain, or discharge, call your doctor right away and have your eyes looked at. So that's a lot of information to a complicated question, but certainly if you do have dry eyes, all hope is not lost. There are options for contact lenses, some of which can actually heal your cornea and make you feel so much better. All right, that's it for today's lesson on the eyes. I thank you for joining me like always. Feel free to like and subscribe, hit those buttons down below, check out the show notes. I have linked all kinds of artificial tears, other videos I've made. You can reference it all down below. I'll see you next week, Wednesday at 4.